closed. And now to the North Dakota COVID-19 watch. Multiple doctors say one rule change could allow thousands more people to be vaccinated for the coronavirus each week. After the final dose is pulled from a vial, there is generally some left over that's thrown away. Renee Cooper asked local healthcare professionals about the possibility of combining leftovers to create pooled doses.
In the beginning of our process of vaccinating our patients, there was a shortage of vaccine. And so in the back of our minds, we were always worried about whether we're going to have enough or not. So that's really a tempting idea.
Sanford Pharmacy Supervisor Gregory Fritz says at this point, there is ample supply of vaccine in North Dakota, but that doesn't mean pooled doses aren't worth considering.
I'm not enough of a technical expert to offer an opinion on it. But if it otherwise is going to go to waste, why not try to utilize it?
Even though the state and the U.S. supply chains are good, North Dakota's chief health strategist, Dr. Joshua Wynn, has repeatedly said we as a country need to be thinking of vaccination on a global scale, or the pandemic will not end.
The idea that we're going to be safe in North Dakota or in America while the rest of the world is having a pandemic is not logical.
For example, Brazil has the second most COVID-related deaths in the world, behind the U.S., but reports just over 2% of the population is vaccinated as of the 1st of April.
And until we get more of the world vaccinated, we're still at risk in the United States.
That said, there are safety concerns with combining vaccines from different vials.
When you are taking vaccines out of a vial, you're piercing that rubber stopper several times. The more times that you do that and the longer those vials hang around, the more chance for contamination there is.
Fritz also worries this could cause vaccine vials to be left out and expire. The pharmacist says other vaccines have been pooled in the past, but with a mass amount of people coming through these sites, regulation of the COVID vaccine would be much more difficult.
Some days we have up to 800 people come through our doors. We are moving fast to try to keep those vaccines drawn up so that those patients can get in and out. It can get really confusing really fast.
Still, theoretically, if the pooled vaccine vials all came from the same lot number, it would be possible. And in fact, Fritz says the Pfizer vaccine sometimes has a full 7th dose left, but it varies.
We've noticed that there's volume left over, but we don't go there.
You only use the 6 doses from the Pfizer?
Yeah, we'll take the 6 and then we abandon it.
And right now, that's required by law. Nothing beyond that 6th dose or 11 for Moderna and 5 in a Johnson & Johnson vial can be given out, according to the emergency use authorization from the FDA that allows these vaccines to be administered. Just last week, the FDA did make 2 revisions to Moderna. One brings the maximum extractable doses up to 11 from 10. The second authorizes another type of multi-dose vial where each contains a maximum of 15 doses. Reporting for KX News in the capital city, Renee Cooper.
Fritz says the biggest struggle with vaccinations in North Dakota lately has been getting people to come in to get the shots that are readily available. The health department